Hey everybody, Luke here, and today we're talking about alphabet soup. So we're looking at the back and the neck, and specifically I'm going to talk about all those little terms you might see if you've had an X-ray report or an MRI report. And if you've ever tried to read your own report, say you had it done in inland imaging and you get a copy, either through us or just you request a copy, it's like, the gobbledygook, the medical lingo, and it's like, what did they even say there? So I thought I would make this video for you guys just so you can kind of interpret it a little bit. And of course, if you're going to physical therapy with us or something like that, we'll always walk you through that kind of thing. But just if you're looking at X-rays or MRIs, and again, specifically for your back and neck today. So I've got kind of a list of things that I'm going to go through here and refer to a little bit. And I'll kind of give you some background on the anatomy too as it pertains to the different terms. So one of the first things you'll see on X-ray MRI reports is things like talking about arthritis or degenerative joint disease, things like that. And basically, they're all kind of the same. It's like a degenerative term. So if you look at the spine, and let's talk about the low back primarily, this is your front view of the spine here. You've got all your bones separated by the discs. On this little guy, the discs are the little foam squishy things. So if you look at the front there, those are like the front of your bones here. On the back, you can see all the little knobs there. Those are the little kind of bumps you can feel along your spine, the back of your neck. Call those your spinous processes. And then where the two bones kind of come together in the back, those are your joints. So you can see them on a model pretty clearly. I don't have you, well, you can see on the camera here. But towards the back here, these are your joints. We call those facet joints. So on like an X-ray MRI, you might see facet degeneration, or you might see degenerative joint disease, or facet arthropathy. And those are pretty much interchangeable. It just means that those joints back there have some degenerative changes, which are arthritic changes, which they can see that real well on an X-ray because there is cartilage between those joints, and they can see that shrinking down. The space will shrink down. So if you see those, that's what it is. They will also grade that, so you have like a mild, moderate, and severe degenerative joint disease, or again, they'll say severe facet arthropathy. Again, same thing, but they'll tell you the level too. So if you look at the low back again, I've got it marked on the spine there. The most bottom vertebrae is L5. Up from there is L4, 3, 2, 1. Those 5 bottom vertebrae are your lumbar spine. That's what they're called, L1, L2, L3, L4, L5. The bottom segment between that bottom disc sits between L5 and S1. S1 just refers to your sacrum. So that's kind of a good place to start too on a lot of those imaging, whether it's X or MRI, is just knowing, okay, what even is L3, L4? The L3, L4 disc. Or the joints, the facet joints at L3 or 4 are where the facets on top of L3 runs into contact with facet on L4. So that's kind of like your arthritic changes. If you took that same idea, you could apply it to your neck as well. Up there, it'll just be like your cervical spine. So that'll be C1, C2, all the way down through C7. So there you go. So those are your arthritic changes again for your your gobbledygook. The next big one you're going to see on these things is a disc bulge or a herniation. I thought I would actually use the whiteboard for this one. So if we draw out some spinal segments here, that's one backbone there. Say it's L5. Here's the disc right here, and then here is S1. Okay, so again, you've got these up here. These are the vertebrae here. So these are bone. That's all bone. Those are those spinous processes towards the back, so little bumps you can feel. That would be the front of your body over here. The disc is right in through here. So I think most of us are familiar with like a disc bulge. We've heard about that. The disc is going to tend to bulge backwards in this direction towards the little roots of the nerves that leave there, so you can get like the pain, the numbness, the tingling, things like that. But you'll see, like, again, a mild, moderate, or severe disc bulge. That's what that means. The squishy material of the disc has been pushed backwards a little bit. And again, if you're not lucky, it touches a nerve and you get like the nerve pain or sciatica, things like that. But with that disc as well, you can also get just like disc degeneration. So they would call that, a disc bulge, disc degeneration, DDD, degenerative disc disease. Sorry, I had a little blank there for a second. Degenerative disc disease. It's a fancy name for your disc has been compressed down, so it's degenerated, it's shrunk, it's compressed. So if you take this as like the normal disc height, and you have severe degenerative disc disease, just means that that disc has been flattened down. And if you look at the back of a spine, what that means is that the bones are coming closer and closer together, and it's starting to close off on some of the space there. And so those are, again, for your discs. That leads into a next topic, which is stenosis. So stenosis, you see it a lot on MRIs especially, but it's a narrowing of a space. So in this instance, if you had severe degenerative disc disease and the bones are collapsing down on each other, the space, which I can show it better on the model, I'll try to give you an up close here. Along the sides here, the space that's created between each of the two bones is where the little nerve rootlet runs out. If you get stenosis, and in this case it would be foraminal stenosis because that's the foramen on the outside, it just means that that space has been compressed. So if you can kind of picture the spine here again, you can see how if that disc shrunk, the space back behind the bones there where the nerve root's trying to run out, that also shrinks down. So you get stenosis. And again, where you run into pain with those kinds of things is if that stenosis or the disc bulge or whatever it is, if something touches on that nerve, that's where you're going to get the pain in terms of the nerve pain. That's foraminal stenosis, so kind of running out the side. You'll also run into something called central stenosis, which if we took a bird's eye view of your back, so we're looking from the top down, what we can draw is kind of like a crown shape. So here's the body of the vertebra, which is the bone. Vertebra is the bone. You run it out here, and out here, more bone, out here and here. Kind of like a crown or a house, some people would call it. Okay, so again, this is the front of your spine down here. This little knob on top is the knob you can fill in the back there. So again, you're looking straight down through it. This came out towards us here. In this space is your spinal cord. So running up and down the length of your spine is your spinal cord. At each section, say between L2 and 3, between L3 and L4, same thing with the neck. Between each section, you've got the little nerve rootlets going out here and here. They travel out into the rest of your body and form bigger nerves like your sciatic nerve or your femoral nerve, all sorts of different nerves, things like that. Where you get central stenosis, though, is that, so the foraminal stenosis is out here again and potentially touching the nerve roots. Central stenosis is around the actual spinal cord itself. So a lot of people will get that if you have, like, say you got some bone spurs developing up here from your arthritis. The facet joints, I can't really draw them on here, but they'd be right around this area in here. So say you got some bone spurs or some arthritis there. Some people too, if you look at like the walls of the house here, we call those your pedicles. You probably don't need to know that, but some people have short pedicles. So you're born with short pedicles, so that brings the whole entire roof of the house down. So that's your central stenosis. That one, it's somewhat common, not always symptomatic though, so you're not always going to have problems with that, but you can. Those people, a lot of times those folks are the ones that end up having like a laminectomy type surgery at some point, because what will happen is if you really just don't have any room around your spinal cord there, eventually it's really hard to stand upright and you'll be bent over for long periods of time. That's the only position of comfort. That being said, there's plenty of people who are bent forward that we can help with physical therapy, help them get upright and reduce that pain. But for someone who just can't get rid of it, there's too much pressure around the center of the spinal cord. That's oftentimes the cause, and a lot of times they'll end up with a surgery. A laminectomy, if you want more gobbledygook for today, this video is going to be too much for most people, so I'm sorry right now, but maybe you can replay it at some point. But a laminectomy just means that they cut the roof off the house. So they cut, say they cut there, and they cut there, take the roof off, now you've got lots of space. And it works really well for people who need it, so hopefully that's not you, but if it is, there at least is some hope there. Let me check on our time here. Video's getting pretty long, but I'm just going to run through two more. So feel free to jet out of here if you need to. But spondylosis is just degeneration between the two bones in the spine. So you'll see it on x-ray pretty clearly around the edges of each of the bones. It's like another degenerative change that you can see. And last one I want to throw out at you, it's a funky one, spondylolisthesis. If you can spell that, give yourself $5 to do what you want with this weekend. But that's a tough one. A spondylolisthesis basically means that one of the bones, the vertebrae, say L4, on L5, has broken somehow loose in the back, and now it's slid forward. They grade that 4 different grades, grade 1, 2, 3, 4, depending on how much distance that thing has slid forward and back. That one potentially is real dangerous, although you'll see people with mild spondylolisthesis, sometimes it's called a spondylo, and not always dangerous there. But if you have like a grade 4, that means that bone is just sliding forward and back potentially, and that's real dangerous, because if that decides to hit a nerve or something, you're in big trouble. So those folks usually, it doesn't go undiagnosed very often, but it can be an issue. The way they diagnose that a lot of times too is they'll have you do, instead of just a static upright x-ray, you'll do call it a flexion extension x-ray. So you'll bend forward and then you'll bend backwards, and they'll take 2 different pictures and see, well, did that vertebrae move? Did the backbone move forward and back? So that's a lot of terms for one video, and that video got long. I'm sorry, I was going to break it into 2, but I thought let's just go for it. So I hope that helps you. If you're coming across those terms, and again, it's on an x-ray or an MRI, and you're just like, the doctor didn't explain it to me, they didn't have time, and I don't even know if I should be worried about that. Is moderate this and severe that and minimal this? Is it really something I should be concerned about? Or, we just have some fear and don't know about it. So if you have questions, ask your physical therapist, or you want to set up an appointment and ask one of us, you're more than welcome to, or leave a comment below the video. And overall, I hope that just helps you, and you can interpret those a little more easily. And again, any questions, just leave a message. Thanks for watching.